Now Nancy Pelosi and Chuck Schumer have found some big ways to get Joe Manchin on board with the fourth stimulus check being sent out. As I said in my previous videos, lawmakers have now agreed to pass President Biden's legislative agenda. It is something they want to get done, and it's finally good. I'm really happy to see that President Biden is stepping up to the plate and sending out more stimulus payments. It's what everyone's been waiting for. Now there are a lot of developments on the next spending bill, everybody. Senate Democrats have announced their proposals to raise the cap on state and local tax deductions. It has been a top of the priority list for Chuck Schumer. Now it's likely to be cut from the revised Build Back Better Act. The Senate Democrats that were involved in negotiations over the bill before Joe Manchin paused negotiations last month to say that there is simply not enough room for the expensive tax change, which Republicans argue would benefit wealthy suburban households in blue states. Now this is a big change in the bill that would affect many Americans across the country. A Democratic senator that is familiar with negotiations on the tax provisions of the bill said that Joe Manchin has signaled that his colleagues and many people in Congress are not a fan of changing the tax break. But this is a disappointing change for Chuck Schumer, who is up for re-election this year and pledged back in 2020 to make repeal of the cap on salt, which is known as the state and local tax deductions. That's a top priority if Democrats want control of the Senate. Now, pulling the salt deductions fixed out of legislation also will make it tougher for the bill to pass through the House of Representatives. Where last week, 3 Democrats from New York and New Jersey insisted that they won't support any bill that does not raise the $10,000 cap. But opponents of lifting the salt cap were quick to note that the number of House Democrats threatening to take the bill over the issue is dwindling, as the realization sinks in their party that they may not be able to pass any version of the bill. Critics have said that raising a cap on salt deductions runs counter to what they say is the main political reason for passing legislation in the first place. Now, for those of you that have been anxiously waiting for the next round of stimulus payments to be sent out, well, the government just did this. The US government has already sent a large amount of money out to Americans since the start of the crisis. Joe Biden said last week that Congress would still be able to pass parts of the social and climate policies that are proposed in the package. One key reason the bill has hit a roadblock is the opposition from Senator Manchin, a Democrat from West Virginia, who is split with his party on many of the key proposals in the package. Democrats are hoping to pass the bill through reconciliation, which would require all Democrats in the Senate to support it. It is definitely important that Congress sends out more relief soon, as the cost of living increases across the country. According to the latest government data, inflation is now at historic highs, and after accelerating at the fastest 12-month pace in over 40 years. Right now, the Democratic Party is tasked with identifying exactly which proposals could stay in a whittled-down version of the bill. Joe Biden actually said there's really 2 big components that I feel strongly about, and I'm sure we can get this done. What do you think about Chuck Schumer, the Democrats, and the Republicans, and pretty much everybody in Congress, folks? Tell me in the comments below, do you believe that everybody's doing all that it takes to send out the stimulus payments, or do you think that somebody's responsible for holding them back?
There are over 200, as you all know, 200 different types of cancer caused by different genetic mutations in our cells. We discover new medicines, therapies, early detection, prevention, measures that extend lives and save lives. In the first 25 years since the National Cancer Act, the death rate from cancer was largely unchanged. Then things began to change. The progress over the last 25 years, the death rate has fallen by more than 25%. But here's the deal. Despite the progress of lives extended and lives saved, cancer is still the number 2 cause of death in America, second only to heart disease. In the last 2 years of COVID-19 pandemic, the pandemic has taken more than 800,000 American lives. But that same period of time, cancer has claimed 1.2 million American lives, year in and year out. For too many patients and their families diagnosed with cancer, instead of hope, there's also bewilderment. Remember, Doc, you telling the family that we had to be able to ask questions and you were available because it's a hard road to understand and to traverse. The feeling of being on your own, a static adrift in a sea of patients, frustrated that hospitals and doctors can't easily share your medical records, or help find answers when there's minutes count, having to advocate for even the most basic care and attention for your loved one, a flood of information, completely different language, in many cases with no one to help you decipher it. Being within reach of a therapy that's too expensive, or your insurance won't cover it. Despite all the progress, there's still a sense of powerlessness, guilt that maybe you're not doing enough because you don't know enough, and fear. So when President Obama asked me to launch our cancer moonshot in our administration, our goal was to bring a new sense of urgency to make the system of prevention, research, and patient care to take advantage of the 21st century science and technology. We began the process. Many of you in this room were part of that. We harnessed the resources of the federal government to change the culture, increase cooperation among scientists, and break down some of the silos. I note parenthetically, I remember I wanted to transfer a particular scan from a hospital in Pennsylvania to a hospital in D.C. And I was told I couldn't do it. Wasn't able to do it. Could transfer just about anything else in the world, but it couldn't do it because the hospitals didn't want the other hospitals to have access to their, because the patients could change their mind for all the records. That included everything from making federally funded cancer research more accessible to the public instead of hiding behind a paywall. We launched trials.cancer.gov so everyone can look up cancer clinical trials across the country and around the world. I travel the country, bringing together leaders of healthcare, technology, education, business, and technology. I visited most of the major cancer centers literally in the world, met with heads of state in those countries, and decided how we could work together to try to make progress. I remember a particularly good meeting in Australia. One of the final pieces of legislation that President Obama signed into law was the bipartisan 21st Century Cures Act, with the help of members of Congress, particularly, I don't know, is Fred Upton here? Fred, are you here? Well, Fred Upton was part of it, and Diane DeGette in the House. It streamlined the Food and Drug Administration, FDA, so that new cancer treatments